Thanks, Maury. First of all, thanks for the invitation. Really pleased to be here with you. So I think of behavioral science or behavioral economics very simply as the science of decision making. Decision making can be both conscious, thoughtful, effortful decision making, but it can also be non-conscious, effortless, automatic, habitual decision making. Think of it as maybe the pilot brain and the autopilot brain. So for the vast majority of our time, it's the autopilot that's in control. And we have to proactively set up the pilot brain or to take over from the autopilot brain to make those thoughtful cognitive decisions. Now, far more of our decisions are non-conscious than conscious. So when you think about that from a market research perspective, BEESY is a behavioral science-based market research agency. We can't ignore the 80 to 90% of decision making that's non-conscious. Otherwise, we're going to miss the point. So then if you think about market research, and we would say the #1 goal of market research is to understand customer decision making, you have to factor in that non-conscious decision making. Now, it goes without saying that you can't ask somebody why they made that non-conscious decision and expect the answer to be correct. So whilst the industry has often said or thinks that the question why is the $6 million question, we think of at BEESY the question why as being the $6 million disaster, because you're going to start developing and designing based on that flawed or false insight. So that's the first piece. If we really want to understand non-conscious decision making, we can't ask people why they made that decision. We've got to look for other ways to get at it. Now, if you think about it from a product or a service perspective, every new product, new service, new application, new solution, for it to be successful, it relies on behavior, or behavior is driven by a decision. We've tended to be very product centric in healthcare to this point, and our perspective would be, if you want to drive that behavior to make your product, solution, etc. a success, not only must you consider the product, but behavior is also a function of the person and the context. And so, I'm happy to give a couple of examples of each, Maury, if you'd like.
Yeah, please.
Yeah. So, think about context. We just recently worked with a client who came to us and said, look, we did some market research. The patient said they wanted this app. They would really, appreciate and use this app, which was, based on the pharma company's product. And then they came to us and said, these patients didn't use the app at all. They said they were going to, they never did. From our perspective, that's pretty obvious. If you're doing market research in isolation and asking people if they would like something, almost always they're going to say yes, but that intention doesn't necessarily translate to action, and you can't look at it in isolation. That app is competing against dozens and dozens of other healthcare apps, most of which have a broader remit or a broader scope than just a product. So for example, a provider app. Then you've got all of the other apps beyond that, and it's just you have to do the research in context to understand whether this is truly a product that's going to get used. Same with physicians, right? UpToDate is an aggregator website or an aggregator resource that is an excellent way of physicians accessing just-in-time answers and information as effortlessly as possible. Now, if you're developing a solution, don't ever expect to replace UpToDate, because it's the Amazon, of physician, in-time information. And so, think about that context. On the behavior side, just one point I'll make, regarding, let's say, some recent work we did with patients on a patient support program, identified 3 different types of patient. One had avoidant behavior. We call it the ostrich effect. I've got this chronic condition. My best way of coping with it is to pretend it doesn't exist. Or there's adaptive behavior. With adaptive behavior, we see 2 types of patient. First patient wants to take control. They want to learn everything they can about that condition. They want to interact with as many people as possible about that condition as a means to try and take control of it. The other type of patient will look at adaptive behavior. They'll satisfy, they'll lower their expectations, they'll compromise, and they'll try and cope. They'll reduce their ambitions as a means of coping and adapting to their situation. Now, as you think about design of digital health solutions, you're going to want to think very differently about how you interact with each one of those 3 types of patient segments. So getting a true understanding of what's the underlying drivers of decision-making and behavior, I think is a great foundation point from which to then build digital health solutions.